everybody. Welcome back to Crime Weekly. I'm Stephanie Harlow.
And I'm Derek Lavasser.
So today we are continuing on with the Gypsy Rose series and the Dee Dee Blanchard series, but we are going to kind of stop the timeline for a minute and do something a little bit different. Well, not really something a little bit different because we've already done something like this in the series so far.
That's right.
Because of the controversial nature of this case, we have different camps, different sides, people who vehemently and passionately believe one thing, and then on the other end of that spectrum, people who vehemently and passionately believe the exact opposite. And in cases like this, we had brought on Fancy Maselli to discuss Gypsy Rose and the fact that Fancy and a lot of people like her believe that Gypsy was sort of a willing accomplice, more of a child actor than an actual victim, and that Gypsy Rose was genuinely and medically ill in a lot of these ways, and a lot of these medical procedures that she received, she actually needed. So we brought Fancy on to talk about that. And now we're going to kind of switch to the other side. We have Dr. John Matthew Fabian here, who actually reviewed Gypsy Rose's case and as far as her psychiatric history and things like that go. So Derek had sat down and had an interview with Dr. Fabian, and we're going to listen to that interview and discuss it, Derek and I together as it goes.
That's right.
So it's be the other side of things.
That's right. And yeah, Dr. Fabian's a forensic and clinical neuropsychologist. First off, it's good to see you back.
Thank you.
You look great.
Thank you.
It's for everybody who's watching on YouTube. And we appreciate all the well wishes for the time off. It was different for me, I can say, because it's been 4 years since we've had a break like that where we haven't recorded anything. So as we said, there's things that are more important than work and Crime Weekly, and our families are the number one thing. So we took time away to take care of that, but we're glad to be back. This interview, originally Stephanie was going to be there as well. This wasn't intentional, but obviously life happens and there's other things that are become a priority. So I sat down with Dr. Fabian very early on and recorded this. And then we had Shannon put it together, and then Stephanie was sent it. So we're going to have the opportunity to watch it together today. And as she mentioned, we had Fancy on. Some of you agree with her, some of you don't. Some of you were really yearning for someone who is a professional in this field, not just coming from a place of research, but someone who actually has a degree in this, who's written books about this. And Dr. Fabian is all of that and more. I'll spare all the details about what he's done, some of his actual books. We talk about it in the interview, but we're going to go through it. This is kind of, I guess, a side quest from our chronological timeline of the Gypsy Rose series, but this will catch us up to date based on where we ended last episode and where we are going to go from here as far as the murder itself. But to put a button on the psychological effects of Munchhausen-by-proxy versus malingering by proxy and whatever he thinks, we gotta get all that out of the way. And that's what we're doing here by talking to Dr. Fabian. And I'm looking forward to hearing Stephanie's opinion on this as well as yours in the comments. So take your time, pause it when we pause it, way down below. Let us know what you think. Anything else I'm missing?
No, let's dive in.
Let's do it. So here we are, interview with Dr. John Matthew Fabian. All right, guys, as you can probably see on the screen now, we have Dr. John Matthew Fabian. I'm going to give you a little bit of his background, but I'm going to let him tell you as well, because he's got a pretty impressive background that I wanted to fill you in. I told him before we hit record, don't be embarrassed. Don't feel like you're bragging. You've accomplished a lot. You should share it. So what I have here is Dr. Fabian is a board certified forensic and clinical psychologist. He's also a forensic and clinical neuropsychologist. And I was interested in Dr. Fabian for a couple reasons, which we're going to get into throughout this episode, but not only because of his extensive expertise, but also because he has some direct involvement with this case. And I'm going to let him tell that story when we get to that. But even more so, as many of you know, there have been numerous documentaries on Gypsy Rose, and Dr. Fabian was a part of one of those where he had the opportunity to actually interview Gypsy while she was still in prison, which was absolutely fascinating. But I want you to hear from him on that and what his takeaways were. We're going to save that to the end. But last episode, we had talked a lot about Munchausen-by-proxy versus malingering by proxy based on what Fancy Maselli was saying. And as I was doing research and looking up Dr. Fabian, I actually saw that one of his publications was about specifically malingering. And it's malingering in criminal forensic psychology and neuropsychological context. This was a publication he did. So he's definitely the guy to talk to about this. And I just wanted to have him on here to let him talk about his background, talk about this case from a generic sense, but also a specific sense as far as his involvement, his evaluations, and how we can look at this case from the perspective of forensic psychology and whether or not Gypsy Rose was in fact a victim of uh, Munchausen by proxy. So, Dr. Fabian, thank you for being here. I really do appreciate it, taking the time to do this. I know you're a busy guy. Why don't you expand upon your background? Because you got a list here, but just as far as what you do, what you've done, what your expertise is all about.
Sure. Thanks for having me. So,
of course,
I was trained as a forensic psychologist and evaluating different mental disorders for legal questions and basically applying mental health assessment to the law. And typically I do that in criminal, but also domestic and civil courts. And I was a director of a court psychiatric clinic in Ohio and worked at like 4 of them, evaluating defendants, adults, juveniles, for pretrial and pre-sentence purposes. So insanity, competency, violence risk assessments, death penalty cases. And that's when I eventually moved to and worked at a maximum security state hospital setting in the state of Minnesota. And that was really working with the state's most dangerous sexually and violent offenders. And so I do that also as a neuropsychologist with defendants who have not only mental illness, but brain injuries or neurological conditions that cause them to, commit different types of offenses. So I work as an expert witness in the court and court system in, around the country, different states, and typically evaluate defendants again for mental illness defenses or sentencing, mitigating circumstances in sentencing proceedings. So when I had worked with Gypsy Rose's attorney in different cases in the state of Missouri, Mike Stanfield, and he had contacted me, right around the time all of this happened, and said, "John, you won't believe, what kind of case we have up here. We think it's a Munchausen, by proxy case. Never seen anything like it. Want you to come and evaluate who we think is the victim of Munchausen."
So I don't know if you asked him this or if it was revealed, but it sounds like Dr. Fabian was hired by Mike Stanfield, Gypsy Rose's defense attorney.
That's right.
So he was paid for his opinion on her competency or her pretrial or like her mental state.
So what happened, and this wasn't in this interview, but I had like an hour phone conversation with him as well. He has a existing relationship with Mike. What happened was originally this phone call happened and he thought that he was going to be bringing Dr. Fabian in to work on it. So Dr. Fabian started to do the research on it, the background, and then Mike called him and said, "I don't need you." So they never really hired him officially to do it because basically called him back and said, there was a plea like that quick. And even Dr. Fabian was like, "Wow, that's fast." So he never actually had to do any work on the case. His involvement directly with Gypsy was part of a documentary, which he'll explain in here, but he never had the chance to evaluate her for trial purposes. It was for this special that took place, this A&E special. So originally thought he was going to be in for that. And then unfortunately, or I guess you could say fortunately for Gypsy, he was never needed to be brought in to serve as a evaluator, I guess, for Gypsy or this case.
I would assume that for the A&E special, he would also have been compensated financially, correct?
For sure.
Okay. And I think it's interesting. He said that Mike Stanfield, Gypsy Rose's defense attorney, called him and said, "I think we have a Munchausen-by-proxy case here. Never seen anything like it."
Yep.
So it's even the lawyers and, the people who are involved with this are like, "This is wild. This doesn't seem to be your typical run-of-the-mill, cut and dry kind of case here. We need more context."
Yeah, they thought for sure that Gypsy was, well, you got to think about it too. Mike's Gypsy's defense attorney. So he obviously wants to build this up as much as possible. Yeah, he wants to make sure that everyone knows that Gypsy was a victim of Munchausen syndrome by proxy. And to the point that Dr. Fabian was making,
He wants to make sure that everyone believes that Gypsy was a victim of Munchausen-by-proxy.
for the defense. Yeah, for the defense, absolutely. That's their job, right? And to bring up those potential mitigating circumstances that they're not trying to dispute the fact that she was part of the murder. They're basically saying because of these mitigating circumstances, there should be some leniency, which clearly, I mean, to be fair, the prosecution agreed with, because I was very shocked when we were talking about this initially that the prosecution would give her such a sweet deal. They basically slammed Nicholas Godejohn and they gave her 10 years. And we have both kind of said indirectly already that she was a lot more involved than 10 years worth of being away. So the fact that the prosecution was willing to take this deal so quickly, it does make you wonder, like, what did they know? What did they know that they were agreeing to this so quickly?
You said, he was brought in to evaluate whether mitigating circumstances, and you said obviously the prosecution agreed, but
Yeah.
I don't agree that they agreed there was mitigating circumstances, because we both know, and I think a lot of people do, that prosecutors make deals with defendants all the time for a variety of reasons.
Yeah, and I agree with you there, but why would they make it for one person and not the other?
I think we'll talk about that.
Yeah, we got to get, because that's my concern in this one is you have two people who are involved in this murder, and we could make arguments all day as to why she may be more culpable than Nicholas Godejohn, right? I mean, yes,
Absolutely,
he had the knife,
yeah.
but that's an argument we could make all day. Some may not agree with us, but we could make that argument. And yet here we are, Gypsy Rose is out there making TikToks, and Nicholas Godejohn has life without parole. So big discrepancy there. So why would the prosecution be willing to make the deal for one, but not the other? Because they had her pretty dead to rights. She confessed to it. So why give her such a sweetheart deal? I do wonder, but yeah, I'll concede that point. Like, why were they willing to do it with her and not him? I don't really get that, but we do agree on the sense that, like, prosecution does make deals all the time in order to expedite the judicial process.
Yeah, there's political reasons. Yeah, they could believe there's mitigating circumstances. It could be for a variety of reasons.
I think that's where it could be, because they didn't give it to her. And Nicholas Godejohn had his own issues. He had his own things he was dealing with.
Exactly. It's not like Nicholas Godejohn is the picture of mental health.
Right. So here we are, two people both struggling in different ways. One gets a sweetheart deal, one doesn't. And the question is why?
Well, I think that they would argue that he's the one that did it, but I think we have argued that Nicholas Godejohn wouldn't even know who Dee Dee Blanchard was if not for Gypsy Rose.
Correct.
So there would have been not a chance that he would have attacked Dee Dee Blanchard out of the blue unprovoked had he not met Gypsy and been primed to do so.
No argument there.
All right, let's continue on.
Her mother, who essentially had the condition, Mike and some of the defense attorneys thought, and it was basically by proxy to Gypsy. So, as you and some of the audience may know, Munchausen syndrome also can be referred to as factitious disorder imposed by another. And essentially, where often a parent, often a mother will create different psychiatric, mental, physical, medical conditions imposed often on a child with the goal or objective, or we'll say motive, of really gaining attention for themselves, for the mother, potentially for the child, but mostly for the mother, which really, I would say, gets some satisfaction for their own ego, their own self-esteem. And there are a number of risk factors for this condition. It was basically transitioned to factitious disorder by proxy, imposed on another, which is different than malingering, which the latter of malingering, feigning or faking mental illness, that is really for a different type of motive. And that's for a different goal or objective or gain. Typically, it's for avoiding some type of prosecution. In criminal cases, we often see individuals malinger, let's say, schizophrenia or hallucinations, delusions, lack of contact in reality. And they may fake or exaggerate these symptoms in order to avoid prosecution. They may perceive they have a chance of being sent to a mental hospital instead of prison, and they may be released early, let's say, because they were deemed not mentally, sane at the time of the offense, usually often a violent offense.
So real quick, because that's interesting. And this is why this is one of the many reasons I wanted to have you on, but Fancy Maselli, who doesn't have any type of medical training in this whatsoever, no actual background. She was referring to the two different types, Munchausen and malingering. Basically, her take on that was that essentially malingering was a lesser offense of as opposed to Munchausen, but the offender in those cases would still be the mom. If I'm hearing you correctly, and please stop me if I'm wrong, Munchausen by proxy, just how it sounds, would be with the mother, or it could be father, but in most cases, I believe it's the mother being the offender, doing these things to create some type of sympathy, whether it's for financial gain or just attention. And malingering would more so be on the actual person with those symptoms. Am I hearing you correctly? Like, is that, or am I misinterpreting that?
Well, it gets a little complicated because it's either Munchausen syndrome or by proxy. So when we're looking at Munchausen syndrome, a person could have Munchausen syndrome or factitious disorder for themselves. So
correct. Gypsy could be creating her own symptoms.
Yes, or the mother could have been if she did not get Gypsy involved. So basically that person is exaggerating, intentionally producing or exaggerating physical, psychological symptoms. And the motive of the Munchausen or factitious disorder is to really have a sick role. Okay.
Yep.
Now that's if they are exaggerating for themselves. Now malingering is faking or exaggerating the physical or mental health symptoms with an external goal or objective motive of really some other gain, like you said, financial, or avoiding prosecution. So when the individual, we call it Munchausen, by proxy or factitious disorder imposed onto another, that person is exaggerating those medical and or physical and mental symptoms onto another person. So mom to child, but in order to really have that sick role, but also to be like a hero. So in some cases, they may be, at a hospital, the child, they've already manifested these different symptoms or disorders onto their child. And then they're in a hospital for one of these feigned conditions, and then the nurses leave, and then the mother strangles the child or suffocates them, and then calls in, the nurse on call and says, "Oh my gosh, he almost suffocated." They want all of this attention.
And that would be Munchausen.
Yeah, and yes, it would affect it, or it would be by proxy. So that would be by proxy. Yes.
Is it possible to have malingering by proxy, where she's saying to her, "Hey, you need to faint, you need to do this, you need to do that," or would that automatically classify as Munchausen? Again, this is coming from a layman. I'm only asking the questions I think a lot of people out there will have, because Fancy was very quick to make that distinction that there's a difference and that they both are applicable. And in her opinion, based on the medical records, it was malingering, but that's not what I'm hearing from you. It wouldn't necessarily be applicable here.
Well, yeah, you want to look at the history and really the documentation, and really what we do in forensic psychology. We're studying human behavior as a psychologist, but really human criminal behavior as a forensic psychologist in criminal proceedings. And you always want to look at patterns of behaviors and motives. And if you're talking essentially malingering by proxy, or malingering fictitious disorder, or malingering Munchausen disorder, really, our psychiatric diagnostic criteria separates factitious disorder from malingering based on the motive. So you can't really have them both. Now, if I may, I do honor that reasoning or analysis. And if I can take it a step further, so Fancy's thoughts may be, hey, mom is manifesting all of these symptoms in her child, they're obtaining a lot of gains. Habitat for Humanity, houses, Disney trips, Make-A-Wish, all of that. And that's for an external gain. But the real motive is sick role for that attention. And the positive, the Habitat for Humanity, the Make-A-Wish are consequences of that. So you always have to kind of differentiate in psychiatry and psychology, the motive. And so, either we have malingering or we have factitious disorder, Munchausen. We really don't have both.
You don't have both.
And I see the overlap, but in our field, they're distinguished.
All right, so we're going to pause it right there. Talked about the distinction. I thought that was important. I don't know if I completely got it, but I want your opinion on it, Stephanie. But before we get there, let's take our first break.
Our pets are our families, and anybody who has a cat knows that your cat is basically, a child to you. And this holiday season, I suggest that if you have a cat, you spend money with our next sponsor, who's donating millions of dollars of cat food to the Humane Society. This podcast is sponsored by Smalls. If you're a listener of this show, you know that we've talked about Smalls before. My mom has a cat, Rascal, who used to be my cat, but now it's my mom's cat. And Rascal loves Smalls. Smalls cat food is protein-packed recipes made with preservative-free ingredients that you'd find in your fridge. And bonus, it's delivered right to your door. That's why Cats.com named Smalls their best overall cat food, which is high praise. I noticed that Rascal heavily prefers Smalls to her previous cat food. And if you're still not a believer in Smalls, New York Magazine called Smalls the best cat food, according to veterinarians, while BuzzFeed said, quote, "My cats went completely ballistic for this stuff." And just in general, for Rascal, I've noticed that she's got a little bit more pep in her step. It's kind of like she's a younger cat again, and her coat is so much thicker, so much shinier, and I actually feel like she's shedding less, and my mom said the same thing. So right now, you can check Smalls out for yourself, and Derek is going to tell you how.
That's right. So give your cat the gift of great food this holiday season by heading over to smalls.com/crimeweekly and use our promo code CRIMEWEEKLY at checkout for 50% off your first order plus free shipping. That's the best offer you'll find, but you have to use our code CRIMEWEEKLY for 50% off your first order. One last time, that's promo code CRIMEWEEKLY for 50% off your first order plus free shipping. Go check them out, guys. Smalls.com/crimeweekly. Okay, we're back. Stephanie, what'd you think about all that? Because I'll be honest, and you could hear it from the interview, I didn't completely get it. It's over my head. I'm trying to understand the difference. I kind of got it, but I wasn't 100% if I'm being honest.
So what I got from it is what distinguishes Munchausen from malingering is the motive. So
yeah, he did say that. Yes.
Yeah, if the mother in this case is looking for attention, is looking to get positive affirmation and attention for herself, it would be Munchausen. If the mother is looking to gain, financially, materially for herself and for her child as a unit, just to make their lives better, then it would be malingering. Is that kind of where you're at or what you took from it?
The main thing I took away from it was the motive part that he said, right? That's the distinction. But if you look up the word malinger, it means to exaggerate or feigning illness in order to escape duty or work. So to me, I still feel like the malingering element could be part of the Munchausen, for example.
Well, he said it can't be. You can't have both.
He said it can't be, exactly. That's why I was a little confused because, and he's obviously right. I'm obviously wrong.
Well, I don't think you're wrong. I think it's so, and he said, yes, there's overlap, right? This is what's difficult because it's hard to wrap your head. So I'm reading from the internet and it says both malingering by proxy and Munchausen-by-proxy involve fabricating illness in another person. The key difference lies in the motivation. Malingering by proxy is driven by a clear external gain, like avoiding work or seeking compensation, which I can say Gypsy and Dee Dee both benefited from. While Munchausen-by-proxy is motivated by a psychological need for attention or sympathy, often with no obvious external benefit. And with that there, often with no obvious external benefit. Essentially, the person with Munchausen-by-proxy wants to be seen as a dedicated caregiver to a sick person under their care, while a malingerer by proxy is manipulating the situation for personal advantage. If you look at this, did it seem that Dee Dee Blanchard was more concerned with the external benefits that they were getting, or was she more concerned with the attention? In my
Yeah.
opinion, it seemed like she was more concerned with the external benefits they were receiving.
I agree with that.
If she was more concerned with the attention, would she not have remained around family? Would she not have remained around people who would be like, oh my God, Dee Dee, you're such a good person? They moved around constantly. Why did they move around constantly? Why did they want to switch communities?
We get into that a lot with Dr. Fabian. So I guess my takeaway, and I thought I said it in this interview, maybe I say it later. I actually don't disagree with you on the fact that the motive, and that's from Dr. Fabian's mouth, right? It's the motive is the main distinction between the two. I agree. If you're to apply both templates, malingering seems more accurate.
Especially when they say that Munchausen by proxy involves intentionally creating or exaggerating symptoms of another person, often with no clear external benefit beyond the psychological gratification. We can say without a doubt, Gypsy and Dee Dee both received obvious external benefit.
Yeah, I agree. The only thing I would push back on with Fancy is, as she was explaining it to me, and malingering by proxy, that was the first time I'd ever heard that phrase before, was during our interview with her. I was, and maybe this was a false assumption on my part, it sounded like Fancy was framing malingering as a lesser offense to Munchausen. Like Munchausen was the more severe, malingering was the lesser of the two. Because she kept saying things like, if anything at all, it was malingering. But I would say now, after speaking to Dr. Fabian, both malingering and Munchausen can have the same type of actions where they could be making their child sick. So it's not necessarily a lesser form of child abuse.
Yeah, both would have a psychological and mental health impact on the victim.
They both require the person suffering from the sickness to inflict some type of unnecessary treatment or whatever on their child. So I think that is one important distinction.
But did you talk to Dr. Fabian at all about whether or not he believes that Gypsy underwent unnecessary medical treatment? Because
Yeah, we go into it.
So also he says here, well, it's, up to the psychologist, the mental health provider to determine what the motive is, and that's how you would determine whether it's Munchausen or malingering. How in this case, with the person suffering from Munchausen by proxy or malingering by proxy, aka Dee Dee Blanchard, being deceased, how would you figure out what the motive is when the only person you have to talk to is Gypsy Rose?
Fair. I don't think you could. But I would push back. If I'm a defender of Gypsy, and I'm not necessarily a defender, I would push back and say, what does it matter if we both agree that she was abused? Because that's really what it comes down to for me. There are people out there who believe Gypsy wasn't abused at all and that she needed all of these treatments.
Exactly. And that's kind of the crux of the issue is what did she undergo medical treatments that she didn't need? And we know she did not have cancer.
Correct.
And her head was shaved, right? So we definitely know right there. But that is also something that, just a run-of-the-mill con artist would do.
Right. Yeah. So I think as we move forward, we can both agree Munchausen, malingering, both forms of child abuse.
Yeah, let's just stop this then. It doesn't matter. It doesn't matter. She was, she went through things that she didn't have to, but was it just a head shaving? Or was she like poked and prodded and had to spend time in the hospital and have a feeding tube when she did not need these things?
And that is something we talk about, the feeding tube. I do apologize. I can't remember if it was on the phone or in there, but we'll see as we get there. And then, so the main distinction there would be the motive behind it. And yeah, that's important. We may never know the real reason why Dee Dee did it, but whether you believe Munchausen or malingering, if you believe either, then you are confirming that Gypsy was in fact abused at some point. To the degree, we don't know yet. We're going to get there talking to Dr. Fabian, but
let me ask you something else, because you've got malingering by proxy, which Dee Dee Blanchard would be suffering from.
Yeah.
Could Gypsy have just been suffering from simple malingering? Also, benefiting from the external stuff. And her mom's like, hey, listen, you don't have cancer, man, but we're just going to shave your head really quick. And Gypsy's like, all right, man, I'm going to go to Disney World. Let's do it. Shave that head, Could she also have been suffering from that?
She could be, but I would say based on everything we know, and Dr. Fabian did say this, based on the historical data with Dee Dee going through something similar as a child as well.
Mhm.
This is a textbook example of it being hereditary, right? Being passed down from generation. Gypsy learned this from someone.
And Dee Dee learned it from someone.
That's my point.
Does that mean that Dee Dee then is just as much of a victim as Gypsy?
It doesn't matter. You could have someone who was a victim of child molestation as a child. If they go on to molest their own child, you don't give them a pass.
That's the point. I would say, and I would argue in this context, it does matter because Gypsy got a pass for murdering her mother. So if Gypsy gets a pass for murdering her mother based on what happened to her, why would Dee Dee not get a pass in the public eye for doing what she did to Gypsy?
I think my argument is that she didn't get enough time, but I think in the eyes of the law, she was arrested. She took a deal and served 10 years in prison for the murder. Now, we could talk about whether we think that's enough or not, but the reality is you can have mitigating circumstances that can be presented as a form of defense regarding sentencing. But to go back to what you said, there are many people out there, and we've talked about it in other cases where you have serial killers and murderers who have a troubled, traumatic childhood and go on to do egregious and heinous things, but they're not given, the benefit of the doubt because of what they experienced. If you do the crime, you do the time. Now, if you're arguing that she didn't get enough time, I'm actually with you. You're not going to get an argument from me. But the fact that Gypsy did serve 10 years in prison and Dee Dee was never charged with any crime, I would say Dee Dee didn't. If she did in fact do this, and I do believe there's some form of child abuse, she didn't answer for what she did, but Gypsy did.
You know what's very frustrating about this case? And what's incredibly frustrating about this case is the deal that was made, because the deal that was made prevented this from going to trial. And Gypsy's own lawyer, Michael Stanfield, said if this case had gone to trial, his strategy for the defense would have been to focus on the abuse that Dee Dee Blanchard inflicted on Gypsy. And this included forcing her to take medication she didn't need, forcing her to undergo medical procedures that were not necessary. Now, Michael Stanfield, as a defense attorney, would have had to have proved that in court. And so we would have had more information about whether these procedures and medications were actually needed by Gypsy. But now he can just say this, like, oh, I would have proven that these medical things that were done to her weren't necessary. But since it never went to trial because she took a deal, we don't actually have the evidence that those things were not needed.
Yeah, let's keep going because he does get into a lot of this, and I think you and I have opinions on all of it. We don't have backgrounds in this, and I think hearing from him, he may shed some light on it. He may answer some of your questions. He may not. We'll keep it going, and then we'll break down what he has to say next.
All right.
And I want to make sure everyone knows you didn't extensively study Gypsy's medical background and history. That wasn't what you were brought in to do, essentially. Mike Stanfield, her lawyer, brought you in to potentially do it, but as you said, it didn't get to that point. There was basically a plea deal beforehand.
That's right. That is fair. Mike called me, and like I said, you'll never see this. This is, a zebra without stripes,
right.
A unicorn, whatever you want to call it. And I'll be honest with you. I mean, this is all I do, and right. I've been doing it 25 years, and you don't see Munchhausen-by-proxy or fictitious disorder opposed by another very often. Okay. And I've evaluated some others who in family or criminal law cases have been suspected to have it. But to have a full-blooded Munchausen case, it is extremely rare. With that said, though, once Mike had contacted me, about this situation, I have a pretty busy caseload, and I said, Mike, I'm going to get to it. And probably 3 months later, I called him. I said, hey, we're ready. And he said, oh my God, we just came up with a plea deal. You won't believe this. And, it was somewhere around I think 10 years. And he said we had to take it. He told me about it. Meanwhile, he did send me the records, which I had started to review. And I've also, admittedly, seen some of these, Gypsy Rose specials, and had looked at some of the discovery, and I was aware of the medical history of her, or what was, I would say, in much part fabricated by the mother, and also had watched and looked at some of the medical records and the physicians who had treated Gypsy, who had concerns as to a Munchausen case.
Yeah, we had talked, so everybody knows out there, we had a pre-interview on the phone because I wanted to pick Dr. Fabian's brain to kind of structure this interview. And there was something you said, and I was driving when we were talking, so I didn't get to write it down, but it stuck with me. And we were talking about that specifically with the doctors, because some people will say there was potentially something going on with the doctors where they knew more, and because they like Gypsy and they like Dee Dee, they were covering things up. But you had a different angle, and it made a lot of sense, where it almost seemed like because there were different doctors and because certain records were going missing, and because some doctors did potentially suggest or infer that this could be a case of Munchausen, that it was in fact Dee Dee who was causing this to happen, almost by doctor shopping, trying to find different doctors that would go along with it for the time being. And when they started to question things, that's when she would move on or even leave the state. Elaborate on that a little bit.
Yeah, I mean, I would urge the interested, folks, that are, in parts maybe obsessed, for no other word, about this case.
And there are some.
Hey, and that, fair enough. It is very fascinating. And I'll say again, when, we're doing heavy lifting in the field of forensic psychology and psychiatry, this is a rare case. So even folks that do this type of work, like myself, are captivated and quite interested in it. With that said, I do like to listen to the doctors who evaluated this child and this family. And so when I did watch this HBO and then the A&E special, which was one I was on, but there were a couple doctors that treated her. There was I believe, a pediatric neurologist. There was also a family doc. And I know the A&E special, I believe the family doc fell on a sword and said, I missed it. And he took accountability. And he said, there were a lot of records lacking. And, the mother came in and the child, I believe at times, was feeding tube doped up. And Gypsy, where the feeding tube, it's my understanding there were different drugs that mother had fed her through that tube to really sedate this girl, so she couldn't really explain what was going on. And mother would take over in these interviews if the daughter, Gypsy, was in fact conscious enough to answer questions, or she would be sedated and really out of it, lethargic, disoriented. And so mother would take over the records. So it's my understanding when they were in Louisiana and beyond that in Missouri, when the mother would take her to one of many different doctors and specialists, she would then, as mom, get these records, make sure the releases were signed so she could have the hospitals and doctors send Dee Dee the records in order to see what they were actually documenting about her and her daughter. And it's my understanding around that Katrina time, there was concerns by one of the doctors, I believe it was a pediatric neurologist, who said, wrote in the documents Munchausen syndrome by proxy. It was concerned about that disorder. And then she scrammed to, Missouri. And then luckily for her, fortunately, the Katrina hurricane led to some demise of some of these medical records in Gypsy's backgrounds, which was convenient, or Dee Dee lied about it, that there were no records because of Katrina, and she could start from scratch with new doctors in a different state with really no paper trail as to this exaggeration of these medical conditions, doctor shopping, as you referred to it. And with that said, in the HBO special, one of the doctors even brought this up at a children's hospital. His concern about Munchausen, I believe, said he was almost run out of the hospital because everyone, nursing, other physicians, medical practitioners, were like dumbfounded. How could you say that? This poor girl, which was the same, theme of Make-A-Wish, Habitat for Humanity, this poor girl. And by the way, this poor girl, because she, in fact, was being, I think, abused and tortured, and certainly was suffering, which certainly we can get into. But Dee Dee, I think was very conniving. She was very sharp and very premeditated and well thought out and planned about how she wanted to cover her tracks with what she was doing. Because there was, with this condition of factitious disorder, Munchausen, I mean, certainly when you're getting on the news and you're getting all these gifts and remuneration and a lot of money and attention, who doesn't like that?
Completely agree with you. Again, that's the reason for having you here, because although limited, you have researched this for numerous reasons, whether it was from Mike reaching out to you, whether it was for the specials you did, looking into this. And so I think I know where you're going, but just to put it right out there, it is your professional opinion that although rare, this was a case of Munchausen syndrome by proxy, or as you referred to it, factitious disorder. You had the fancy term for it.
Factitious disorder imposed
by another,
typically onto a child. And again, just medically, psychologically, psychiatrically, you're really looking at motives with the diagnoses. And the behaviors may be similar, right? Exaggerating medical, physical, and or mental symptoms, disorders on self or another, the child. Mm-hmm. But the motive is different. Is it to gain attention, or is it to really avoid or get an external gain separate from Make-A-Wish? And I know there's some overlap there that's difficult, but whenever you have one of these cases, those are the two differentials you look at mostly. Is it malingering? Is it Munchausen? Which one and why?
So I thought it was interesting that he says, well, who wouldn't like that attention and the money and the gifts and things like that? It sounds like he's describing in that situation that the motive would both fall under factitious disorder and malingering, because he's saying himself, there's the external gain of financial gain, getting something, but also, yeah, she loved the attention. So it kind of feels like no one really knows which one it was or what it falls under. And he keeps saying, it's confusing. There's gray areas. There's overlaps. It is. So I'm not sure, without the patient, which would be Dee Dee Blanchard, being there to psychologically evaluate, how any mental health or medical professional could say with any certainty what she suffered from, especially with these gray areas, and him basically saying, yeah, it must be nice, financial gain, attention. You're using both motives and then going on to say, I believe this was factitious disorder.
What I interpreted from it was factitious disorder imposed by another. The symptoms of that would be the same as malingering. The motive behind it would be different. And we can't determine the motive. So if the motive is the distinction that determines malingering or factitious disorder by proxy, by another, but the symptoms are the same, the more common one would be the factitious disorder imposed by another. And that's why they're classifying it as that, because as you mentioned, Dee Dee's not here. So you can't interview her to determine the reasonings behind carrying out those different forms of behavior, the factitious disorder by another.
He also said that factitious disorder was very, very, very rare.
Yes, he did. He said that very times on the phone interview and in this. That's why I was so surprised by this.
But according to all the available research, malingering by proxy is considered to be far more common than Munchausen by proxy.
I don't know that. I went with the doctor. He said I think Stephanie, and I know you're giving devil's advocate, which I love. I think we can't get too caught up on factitious disorder, or for the sake of this conversation, to keep it consistent, Munchausen by proxy versus malingering, because I think that's where we get lost in the weeds. I think the main takeaway for us is, what I wanted to know is if the level of abuse was the same with the two, because that's what matters to me, is that was Gypsy abused or not. And when I was hearing it from Fancy, the way I was interpreting it, and it could be my fault, I'm not putting it on Fancy, I was looking at malingering almost like first-degree murder versus second-degree murder. You follow what I'm saying? Like,
so you feel like she made it seem like, oh, malingering's not as bad.
Correct. That's how and what I'm taking away from Dr. Fabian is that they're both the same.
Okay.
That's what was important to me.
If the medical diagnoses and what she was receiving medically was not needed, the level of abuse would be the same. It wouldn't matter whether it was malingering or
Correct.
factitious.
That's what I take away from it.
But we have no clear indication of whether or not Gypsy actually needed the majority of these medical treatments.
That is the holdup from what he's read, from what Fancy has seen. And I haven't seen the medical record, so I'm not pretending like I have. But according to him, and I don't think you're disputing it, and I don't even think Fancy's disputing it, there were doctors who raised concerns during their evaluations that Munchausen may be present.
And even Dr. Fabian said when that doctor said something, all the other doctors and nurses, everyone in the hospital was like, what are you talking about?
Went after him, whoever it was.
So I think there was just that one dude. Everybody else, all the other doctors continued. And like I said, doctors don't insert feeding tubes into a child just because the mother said she needs one.
Yeah, it's tough. I think that comes down to what you want to believe. I think Gypsy saying it, there were doctors who brought it up who didn't know that this was going to become what it became. She was shaving her head when we know she didn't have cancer. We have videos of that. We know that there's videos, we've seen them, where she's letting her daughter walk around with a shaved head pretending she has cancer for a house. That's a problem for me.
Doesn't that maybe suggest that all these doctors who treated Gypsy need to be spoken to? Why is there not an investigation?
I mean,
because if they
one of them said it. He said, I missed it, or she missed it.
One of them.
Yeah.
Yeah, but the others.
She didn't stick with the doctors very long. She would take off and go to the next one. She stuck with that one
doctor. She followed him from Louisiana to
because he was going along with her.
To Missouri.
The guy wasn't doing his job.
But then all the other doctors that because he would be the specialist, right? And then he would give her to other doctors that he would, what is it called? When you refer. He would refer them to other doctors with specialties and things like that.
Yeah.
And those doctors also just did the treatments, did the medical procedures.
Yeah.
Why would all of these other doctors do all of these medical procedures without any medical evidence that they were needed?
It's a good question. Well, I'm interested to hear when we hear the end of this interview where you fall, because obviously at the end of this interview, so we can move on with the story, I do think we both have to answer whether or not we feel Gypsy was abused. That's the whole point of this. So let's take a quick break.
Yeah.
Yeah, we timed that one. Right. Time that one. We'll be right back.
Most beauty brands don't understand everyone's specific hair needs, but Prose does. They have a formula that can address my specific type of hair concern, and this makes sense because Prose knows that my formula for my hair care should be based on me. And if you're wondering whether custom hair care is worth the hype, let me tell you, it is. And that's why I'm obsessed with Prose. Since 2017, Prose has transformed traditional hair and skincare with a made-to-order model that reduces waste, celebrates unique beauty over one-size-fits-all beauty standards, and works better than off-the-shelf alternatives. And because you're always changing, so is Prose. Your formulas are going to evolve alongside of you, and Prose is going to address any new concerns. They can also adjust your formula with the seasons, and they learn from your feedback for an always custom fit. Prose also offers custom skincare, so whether you're looking for stronger strands or brighter skin, it is time to discover the difference of custom hair care and skincare that's made just for you. With the Prose Promise, if you don't love your first order, it is on the house. So there's never been a better time to switch to custom. And right now, Derek is going to tell you how you can check Prose out for yourself.
That's right. Prose is so confident that you'll bring out your best hair that they're offering an exclusive trial offer of 50% off your first hair care subscription order at prose.com/crimeweekly. So take your free consultation, get your one-of-a-kind formulas, and see the difference custom hair care can make with 50% off at Prose, that's prose.com/crimeweekly. And you don't think in this case, malingering is what's at play here. It's your professional opinion that this would be a case of Munchausen syndrome by proxy.
Right. And the thing, the issue here is we're looking at labels. Right. And it's the same behavior. So if you're saying, hey, they were malingering for an external gain of money and attention, it's just
at the end of the day, it's child abuse.
Yeah. And at the end of the day, we have a psychiatric manual and it just says it's factitious disorder. But, at the end of the day, hey, if it was exaggeration for Dee Dee and, her daughter to benefit, well, then that's what the symptoms are. It's just called something else.
I'm with you. So we have that down. We're there on that. And now the next thing.
And,
that a lot of people,
by the way, if I may say something,
please,
when
by all means.
when you're 5 years old and your mother is an adult,
Mm-hmm.
and your mother is manifesting these symptoms for a 5-year-old daughter, your external gain of attention, that is the factitious disorder imposed by another and the Munchhausen-by-proxy. Your daughter ain't malingering when she's 5. She's being abused.
It's funny you say that because that's where I was going with this next. It's a perfect segue because there's a lot of dissenters out there. There's a lot of people that believe that Gypsy was making this all up, or that Gypsy was being treated for actual issues as far as the chromosome disorder, and that Dee Dee was taking her for these symptoms, even though at the time they didn't know what it was. But they were warranted, is the argument on that side. But even for the people who are kind of in between, you say, okay, maybe there was malingering by proxy. Maybe it was a lesser extreme, which we've already kind of discredited that. It doesn't work like that. It's not a lesser offense. But even those people say, okay, when Gypsy was young, 4 or 5 years old when it started, yeah, it's on Dee Dee. But as Gypsy starts to get older, 13, 14, 15 years old, and we have video that we've played where you have news crews showing up to the house and Gypsy's able to explain herself and she's rolling around in the wheelchair and she's talking about these things that she has going on with her and how this is the perfect little life. At that point, does Gypsy know what's going on is wrong? And does the responsibility shift? Does it start to become more of a partnership than a one-sided thing with Dee Dee? How do you feel about that notion?
Yeah. So I work with juvenile and adult offenders, and the the goals and objectives and the foundations of juvenile court are much different than adult court. So I look at it that way. When we look at like moral culpability of offending, it's certainly different with juveniles and adults. And so that's why we have a juvenile versus an adult court. But this case goes beyond that because, as I and other people have referenced, Gypsy was living in this time warped bubble where she didn't even know what her age was. When I talked to her, she thought she was 20 when she was 24, okay, or thought she was 14 when she was 19. And, her mother kept her in such a protective bubble in order to reap the benefits of this factitious disorder that Gypsy was emotionally disabled. Like when we look at Nicotijon, which we'll talk about
Yes,
in a bit,
absolutely.
Autism, we used to say Asperger's
Yep.
disorder, which is now mild autism or
Okay.
autism, mild in severity.
We had a lot of commenters correct me on that one, so
Well,
I
right.
appreciate you bringing that up.
Sure. When someone's intellectually disabled, that means they're cognitively, intellectually, their cognitive ability, they're disabled. When someone's autistic, they're emotionally and socially disabled. Well, she was, in a sense, based on trauma, I would say abuse and neglect, emotionally and socially disabled because she was not allowed to live in a normal environment and socialize appropriately, which is going to really stunt her psychological, emotional, interpersonal development. And so when someone is, let's say, 13, as you said, really she wouldn't have been emotionally, psychologically 13.
Yeah, what age would you put her at in that? Because we had this discussion, even looking at the police interrogation footage. I had said to Stephanie, how old is she there? 23? Yeah, you know what? That doesn't sound or look like a 23-year-old to me.
And it is difficult. So a lot of that is speculation. There are some different tests that we can try to get age equivalence, but I would probably at 23 put her at maybe 15, but probably maybe younger than that, right? And so And without really assessing her deeply, it would be difficult to figure that out more specifically on an age frame. But certainly 23 chronological age would not have been 23 emotionally, socially growing up the way she did. So she's growing up in a time warp bubble where she is emotionally, socially behind. Now go to John though, had autism.
Yep.
And that's a neurodevelopmental condition in and of itself.
Right.
Separate maybe from his background, and he could have been abused and neglected, which would further impair and stunt his emotional and psychological growth. But you're seeing that through abuse, trauma, neglect, emotional, social deprivation, and she's behind. He is through at least mild autism, but you know what? It's a good fit. And that's part of that fit.
And we're going to talk about that because as we transition to that, that is a dynamic that we talk about the dynamic and the position of authority when it relates to Dee Dee and Gypsy and who was in charge. My takeaway from this, from hearing from you, is it's Dee Dee all the way, even as you get older, because the symptoms and the damage that is done at that early age is what allows that control over Gypsy as she gets older. And what I was looking at when doing this, because again, that's where people start to say, oh, Gypsy knew right from wrong at that point. And a lot of people said, hey, listen, when you're groomed and manipulated all those years, that has a lasting impact. And I think that's where I want to round this out, because although you haven't specifically looked at the medical records and broken this all down, there are probably, I'm assuming, some psychological effects that it has on a young person that carry over into their adulthood. And not only with the interrogation footage, but even looking at footage with Gypsy, is it your professional opinion based on how Gypsy conducts herself? Are there signs to you there based on your experience that suggest, yeah, the reason Gypsy talks and acts like this is because of the impact and the symptoms from what happened to her when she was a child? Because as you said, she doesn't talk or act like someone who is 22, 23 years old in that interrogation footage. And I would even argue that some of the more recent things that I've seen, it still doesn't seem like a person who's talking and acting the age that they currently are.
You bring up some really good points here. As far as you mentioned, again, we're looking at moral culpability. We're looking at blameworthiness.
Yeah.
We're looking at what does that person deserve as punishment.
Mm-hmm.
And you're also looking, when you're looking at right from wrong, you're also looking basically at a mental illness defense of insanity. Now, if I may, it's my understanding the insanity defense for adults in Missouri is whether the result of mental disease or defect, did the person know or appreciate the nature, quality, or wrongfulness of their conduct. So when we're looking at that, if you are a victim of Munchhausen-by-proxy as a very young child and essentially brainwashed to believe you have these conditions, and eventually, I believe as an adult, handcuffed to the table, essentially not free to leave the house for days, homeschooled, and living in this bubble with your mother who is very sick. I mean, that's a severe abuse or neglect, even if you're going to Disney World. And with that type of trauma, one can believe, can fabulate, can really believe that these conditions are real. Okay. And so when you're not having interactions and consequences of life and, tripping and falling and failing tests, having breakups, knowing friends that were killed, just different life circumstances, but rather you're just encapsulated in this mother's time warp of sickness. Your ability to really navigate the world is compromised, and your ability to really understand nature of cause and effect relationships, consequences, really appreciate your behaviors and how they affect other people and other relationships, and really being able to appreciate, the consequences and severity of these types of behaviors, thoughts, decisions you have, it really lowers that person's like culpability, blameworthiness, and could be relevant to even a mental illness defense.
So I'm a little bit uncomfortable with this because, once again, Dr. John Fabian spoke to Gypsy, did not speak to Dee Dee Blanchard.
No.
So the things he's saying, and he's stating them, I'm sure not intentionally, but if you were somebody who was not familiar with this case and you listened to him, you would think he was stating them as fact. Gypsy was handcuffed to the table, not allowed to leave for days at a time. There's no evidence that that happened besides Gypsy's own word. And she was in prison for murdering her mother. So we could say she has some motive, a large motive, to lie and make her scenario and her situation seem worse than it was. There's no evidence that she was ever handcuffed to the table. We can't ask Dee Dee Blanchard if that was true. She probably wouldn't tell the
She would
truth
deny
if
it
it was
anyways,
either.
yeah.
Right. But the point of the matter is there's no actual physical evidence. I wouldn't even say there's circumstantial evidence. It's just Gypsy saying that this stuff happened. And Gypsy, as we know, and I mean, he just said, oh, she's mentally like, I would say a 15-year-old. I'd have to actually diagnose her and, talk to her more to say that for sure. But okay, so she's a 15-year-old, but yet you're taking her word as if that's exactly what happened. And you're using that to give a theoretical diagnosis of factitious disorder by proxy, right? So I'm not comfortable with that. There's no evidence that Gypsy was handcuffed to the table, not allowed to leave for days at a time, especially at this time when she's stating this happened, because she had neighbors who said she was out strolling around, hanging out with her neighbor, talking on the internet all the time. It didn't seem like she was ever held prisoner, to be honest. There's no actual evidence that that happened. So to state it almost as if it's a fact, once again, sure, he did not do that intentionally. But if you didn't know this case and you weren't aware, you'd say, oh, this is a mental health professional. He is familiar with these disorders and he spoke to Gypsy. He knows what he's talking about. In this case, I don't believe that he has a leg to stand on saying she was handcuffed to the table and not allowed to leave. And so that's huge abuse. Yes, if that happened, that is huge abuse. We do not know that happened.
What I was trying to get at, maybe I didn't do a great job in the interview portion, but I was asking him, are there behaviors she displays now that would give credibility to the fact that she was abused as a child? Are there symptoms that you would see in an adult that would indicate they had been abused as a child? And one of those things was that lower emotional intelligence that she does display now. So that was one thing that he was trying to explain, that the way she acts and speaks now is indicative of someone who was abused as a child, although he doesn't have the factual proof. The only other thing I would say is that you're right. There is no physical proof that she was handcuffed to a table. There was no physical proof that she was abused in a lot of ways. I would only add to that there's also no proof it didn't happen.
And I would also add to that I've seen Gypsy Rose drop her act and speak and behave normally many times. It could possibly and potentially be that she talks like a little girl and acts like a little girl and this doesn't mean she wasn't abused, because I think we both can agree this was not a healthy childhood for her. No matter which way you cut this pie, things could have been better. However, she may have learned early on, hey, if I act like an innocent little girl, if I behave like an innocent little girl, if I sound like an innocent little girl, it's easier for me to manipulate people. And you said something earlier, you're like, well, she confessed to it. She confessed to killing her mother eventually, but not that first, several hours of interrogation where she sat there talking in this way and behaving like this little girl that she wasn't. And she, I believe, did that specifically in order to, I'm innocent. How could I hurt anybody? I'm completely harmless, sir. There's tons of evidence that she doesn't always speak or act like that. And it may be a mask that she wears, a costume that she wears in order to manipulate and get what she wants. And did she learn that she has to manipulate and get what she wants and people please, essentially, based on her toxic childhood? Most likely. But that doesn't mean that she doesn't know the difference between right and wrong. And she does not know that what she did to her mother was wrong. If she didn't know that it was wrong, AKA a mental illness, like you can't tell the difference between what you did being wrong or right, she would not have lied about it to the police.
I'm a little confused because on one hand, you're saying a lot of the things she's doing now is because of her toxic childhood. Well, what is your definition of toxic childhood?
I can say that we don't know the extent of any abuse she suffered. We only have her word to go on it. But based on just in general, the way she behaved then, the way she behaves now, this is not somebody that had a healthy, stable childhood, regardless. But so many other people don't and do not kill their mothers, right?
Or don't act like she does now.
Don't act like she does now. You eventually sort of, learned that that's not the way. But the fact of the matter is, he had said, Dr. Fabian had said earlier, in the state where she was going to be tried, to say that you're not guilty based on a mental deficiency, you would have to not know that what you did was wrong. The fact that she sat at that police station and lied about what she did to her mother for hours and hours and hours lets me know that she knows what she did was wrong.
I mean, she's been lying her whole life.
I know.
So, I mean, it's something, that's all she knows. Like, there's pathological liars out there that aren't even murderers where you can't
100%.
They just lie to lie. Like, even when it's something innocent, they came in second place on this huge test, but they got to lie and tell you they came in first because it's like, why are you lying though? You did really well. What's the point? And they can't even explain to you why. It's in their nature. But I will defend Dr. Fabian just a little bit. I did say it at the beginning, and I think it's important for our audience to know this. Like, he did not do a lot of research on this specific case. We're speaking in generality. And yes, at that point, he's referring to Gypsy Rose's statements and some of the medical reports where doctors had suggested there might be something, but by no way, shape, or form has he spoken to Dee Dee extensively at all. And so
would you say that he extensively went through Gypsy Rose's medical records?
No, he said he started to.
Okay.
Was his exact words.
Okay.
He was never involved in the trial. He interviewed Gypsy.
Well, there wasn't a trial. There was a trial for Nicholas Godejohn that Gypsy testified against him in.
Right. But he wasn't involved in the trial. He wasn't hired. Essentially, he was like, hey, here's the heads up. You might be involved in this case. He got the records sent to him, started looking at them, talked to Michael, Gypsy's lawyer, and he said, don't need you anymore. They came up with a deal. And then he was involved again for the A&E special, but he's by no means an expert on this case, but he has spoken to Gypsy, which we're going to talk about, and he's interviewed her, and he's also someone who I would consider an expert in this field. Like I said, you can go look at his resume. He's written multiple publications. This is what he does every single day.
He is the real deal, but it doesn't matter at the end of the day if you're an expert in your field if you do not have all the information to build a complete puzzle with. If you're missing pieces here and there, and in this case, I'd say a lot of pieces are missing.
Well, that's the point of having him, though, because I would push back and say Fancy, who has a lot of the information, wasn't there either.
Well, she doesn't have the full puzzle either.
She doesn't have the full puzzle, and the only difference I would say between her and this guy, Dr. Fabian, is he really doesn't have any skin in the game. He did one interview for A&E. He was compensated for it. He was a talking head. I've done many of those. He doesn't, whether Gypsy was a victim or not, he didn't put his name on the line. Fancy has a lot more skin in the game when it comes to the outcome of this case than Dr. Fabian.
I don't agree. I think that
How don't you agree?
I think Dr. Fabian, as the prestigious mental health professional that he is, if he stated something in an interview for, I believe it was HBO, by the way, he keeps saying HBO.
He didn't do the HBO series.
So he's just referring to the HBO series. He's referring to the doctor who said something.
Let me correct it. He only did one of the two. I believe he did A&E, whatever the one that the Michael didn't do.
If he goes on the special and he states his belief that Gypsy was a victim and that her mother suffered from factitious disorder, then he would have to sort of to stay on that hill, if he wants to, as a mental health professional, as somebody who's...
What if he believes it?
He could believe it, but I don't know how you could believe it to that extent without having the majority of the information.
Stephanie, if he's diagnosed and treated multiple people that are victims of factitious disorder by imposed by another, he knows what the symptoms look like.
Uh-huh.
He knows what the same way I look at somebody who's using heroin or some type of other drug, I can see them and see symptoms in them that I recognize because of my professional experience.
Uh-huh.
That's all I'm saying.
No,
he may actually believe it.
I believe that he does believe it. Yes,
I do too.
But I think he believes it. But even he himself would probably say, would I go to trial based with what I
No, of
have
course
and
not.
testify
No.
to that effect? No,
No,
I
of
wouldn't.
course not. I agree.
Okay.
He'd want the full book for sure, and he'd have access to that. But I gave him a qualification at the beginning, saying, "Hey, we're talking a lot in generality, but he did bring up the handcuffing incident, so I have no problem with you addressing that and saying it because you're right. He doesn't know that happened for sure. So if you want to put an asterisk on that part, I don't actually have an issue with it. I think it's important, but yeah, I think right now we'll take another break and then we'll continue on with the interview. Good discussion so far.
Sounds good. So I'm the kind of person that just wears sports bras all the time, and it's more about a how does this feel and how comfortable am I rather than a look thing, like how do I look? And I know that there's a lot of underwire and push-up bras that would probably make everything look better but not be comfortable. At least that's how I felt until I found Skims bras, because Skims bras do both. They make me feel confident and comfortable. They make me look good and feel good, because I love the look of wearing an underwire bra and a push-up bra, but I hate how it feels. The Fits Everybody push-up bra is my favorite Skims bra. I have it in several different colors now because at this point, every time I leave the house, it is the only thing I wear. The lift is perfect. There's not too much padding. You get amazing cleavage. It's not like weird, lumpy, kind of like one side hanging out and the other side snugly in. It's very beautiful. It's very even. It's very comfortable. And I love Skims. They have so many different things. They have clothes and pajamas and bras and underwear. And I have so many pieces from Skims that I'm just very impressed with everything they put out. So
I concur with everything you're saying, by the way, Stephanie. Same experience.
same experience. Well, why don't you tell them how they can check Skims out for themselves then?
If you want to get a bra just like mine, you can shop Skims bras at skims.com, now available in 62 sizes. That's right, 62 sizes from 30A to 46H. And if you haven't yet, be sure to let them know that we sent you after you place your order. Select podcast in the survey and select our show in the drop-down menu that follows. We would greatly appreciate it. Go check them out, skims.com. I don't know if you're intentionally alluding to this, but as we're going to talk about the murder itself, some of what I heard in there is the inability to understand. Basically, Munchausen by proxy, a byproduct of that are some of the symptoms you just described. And when we start to think about premeditation of a murder, how being a victim of that crime, Munchausen by for so long, can have an impact on the ability to understand what you're considering, what you're going to carry out.
That is true. And I've had juveniles who have been charged with murder, who I've evaluated, who have told me, I just really wanted to know what it was like to kill someone. And, there's an immaturity to that, certainly. But the Munchausen can really have a similar but differing effect on that person and really how they view the world and others in an autistic sense, I think, because they have a hard time reading and navigating the world. They've never been outside, really.
So let's just go there then, because I think we've kind of covered the Munchausen by proxy and as far as where you fall. Stop me if I'm wrong, if maybe I'm interpreting it wrong, but your professional opinion is, yes, this is a clear case of that, although rare. And a lot of what we're seeing today is a byproduct of what Gypsy experienced as a child. Is that fair to put a pin on that and say that?
The pin almost. And that the reason is because, when I first was looking at this case and talking to the attorney and then talking to Gypsy, I was like, and, A&E kind of said, hey, we're really looking at the future. How would this Munchausen affect her in the future? She's going to be released on parole.
Correct.
What's the future look like? Relationships. And I'm always wanting to, I think, and others were like, God, I would just do anything to evaluate Dee Dee.
Yeah. Oh,
okay?
yeah.
So we're looking at her and what I knew about some of the records and just some of the documentaries. What were the risk factors for her to actually develop Munchausen or factitious disorder? It started with her. So what was her childhood like? Forget Gypsy for a minute. And that was
We covered that
where
extensively, by the way.
I learned the trauma that she
Oh
had.
yeah,
Mother was obsessed with her own Dee Dee's physical
that's right.
conditions, overprotective. And, these risk factors will lead to not only like damaged attachment with your primary caregiver, your mom, who's doing this to you, but it also will really damage your sense of development, sense of self-esteem, your identity, and it can lead to personality disorders, really related to how you view yourself, the world, and how you really are interpersonally.
Makes sense to me. It makes sense, and we covered Dee Dee extensively, and you do kind of see, for a layman way of saying it, this kind of like this transitional from Dee Dee's parents to Dee Dee to Gypsy, right? It's the apple doesn't fall far from the tree kind of thing, where it's almost gotten worse as it's gone on.
Right. And putting the pin on it, meaning, hey, what are the risk factors for Dee Dee to have had Munchausen?
Yeah,
And you have them. So
you
that gives
definitely
you
do.
more evidence that this is that type of case.
So not only do you have the historical evidence of it, where Dee Dee would be a candidate for something like this because of her childhood, but then you actually have the circumstances surrounding Gypsy, where the symptoms that are being described, the psychological symptoms that we're seeing from Gypsy herself, all line up with this being a case of Munchausen.
Right. And Derek, these cases, you always have to look at the multi-generational effect.
Yeah, that's a great way of looking at it. You have past, present, and future. You're combining them all, totality of circumstances. It's not just one independent thing where you're coming to this conclusion. Fascinating. Let's transition. We could talk about this for 5 hours. We've done it already with this case. You mentioned Nicholas Godejohn, and everybody who's listening to this or watching this kind of knows, but at this point, for even the people who are not disputing the belief that this was a case of Munchausen by proxy, we get into the situation now where Gypsy and Nicholas are starting to, they meet in 2012 on a dating app, and they talk for about 3 years. There's a lot of dynamic there, and I had sent you the DMs. I don't believe you saw those Facebook messages beforehand, so you're not by any means an expert on them, but we talked about them a little bit. You had a chance to review them. We went over them extensively last episode. And when you read those messages, even after everything that we just talked about, when we talk about culpability and responsibility, yes, you talk about how Gypsy, based on her past, may not understand the significance of what she's suggesting. But I think from most people out there, the question would be, okay, we understand that. But at the end of the day, if she carries out a murder, you still have to be held responsible for it. If that's what you did, if you were part of that planning. So when we start to look at these messages that go on between Nicholas and Gypsy, we know that eventually Nicholas is charged with first-degree murder. He's still in prison. And we know, as you mentioned already, Gypsy ended up getting a pretty good deal. Second-degree murder. It was a plea deal. I think she did about 10 years. She's out walking amongst us. When you look at those messages specifically, you see some things from Nick, you see some things from Gypsy. If you're to believe Gypsy, she basically says it was Nicholas. He was the driving force behind this. He manipulated her. He corrupted her. We talked in last episode how some of the things that she accused Nicholas of have been verifiably proven wrong, like the idea that he got her involved in BDSM. That's not true. That happened previously with another person who, by the way, was much older than Gypsy, and that was a crime in and of itself. Dan, egregious, gross, just another wrinkle in this story. Terrible that Gypsy experienced that as well. I'm sure that didn't help her situation. But there's already been things that Gypsy's tried to put on Nicholas that we know are not true. So is it possible, when looking at this dynamic and we talk about the percentage, the responsibility of who basically manifested this idea to kill Dee Dee, based on how they were charged, you would think it's mostly Nicholas. But when you see these messages and you think about what we have here, not only with Gypsy, which we've discussed at length here, but also Nicholas, as far as his mental symptoms, you mentioned earlier, it used to be referred to as Asperger's. It's not anymore. Now it's autism. When you see those messages, what do you see as a professional?
Well, Derek, can I ask you a question?
I'm scared, but yes, go for it.
Cop, PI, who had blood on their hands? Who had Dee Dee's blood on their hands?
It was Nicholas.
So, I mean, that raises...
Physically he had it, but...
That raises his culpability, right. But for him stabbing her, she would not be dead.
That is true.
Okay.
I see where you're going.
So, right. So the elements of the crime were the mental state and the act. Right. So he did the motion of the stabbing. Right. Now, to answer your question, though, when we're looking at really how did this plan form? Well, it's my understanding this is the first Munchhausen-by-proxy where the mother or the parent was murdered.
Right.
Okay.
So, I don't know if that's true or not, but I'm rolling with you if that's your understanding.
I was told
if we're
that,
wrong, we apologize ahead of time.
Well, I was told that by A&E.
Okay.
When they took over my house for 13 hours. And so they told me that. And internationally, it was a big deal, right? So that's how rare, so Munchausen by proxy is what, 110, 15 cases out of a million.
Wow.
Okay. So when you have a murder of a parent, it's maybe happened once. I mean, we're talking about like the chance, the probability of this type of event happening is that's why we're here. That's why it's a big deal.
That's why everyone's so fascinated by it.
Right.
So I just want to cut in really quickly because once again, I don't like this classification of him saying, oh, well, Nicholas Godejohn is more culpable because he did the stabbing. Yes, I suppose, subjectively. But you also have somebody like Charles Manson who never touched the victims that he served life in prison for their murders. He just simply manipulated his followers, other people, to kill those individuals for him. He served life in prison for that in California, of all places. So once again, I think it doesn't make me feel super comfortable to have a kind of insinuation. If you're very good at manipulating people and getting other people who maybe are not also the most mentally healthy to do your bidding, you're less culpable. I do not believe that at all. And I just want to say that for the record. I don't think that if you're able to manipulate somebody who is clearly very easily suggested to do something for you, to do your dirty work for you, that makes you less culpable in any way, by the way.
I'm kind of saving it for the end because in my opinion, two things can be true. I can feel one way about the child abuse and different about this. I don't think we're ever going to agree with everybody completely. And I kind of pushed back on him a little bit there when he said, but who did the stabbing or who's responsible? And I said, well, physically he did, but figuratively, I would argue the blood's on both their hands. So we'll get to that.
I find it very, very interesting that this is the first case of, and I mean, once again, he's using the factitious disorder and Munchausen-by-proxy sort of interchangeably throughout this episode.
The correct terminology, I guess, is factitious disorder imposed by another now. The word Munchausen's, I guess, not the recognized term anymore.
And he corrects you when you use the term.
He doesn't like it.
But then he does continue to use Munchausen-by-proxy.
I think he's doing it for my sake.
He's doing it for you. That's nice of him.
He's dumbing down himself.
Also easier to say than that entire factitious.
It sounds bad. I like factitious disorder.
Yeah, for sure. So I think it's interesting. This is the first case of that where at least known, where a child has killed their parent. And I think that's important. And I want us all to put a pin in that and remember it for future episodes.
I don't even know what that's referring to, but okay.
You will. Let's continue on.
But you also have two vulnerable, I would say, you want to say victims, but they're perpetrators, right?
Right.
But I kind of throw in Nick as a victim of this Dee Dee thing because, but for Dee Dee's craziness and factitious disorder, we wouldn't be here either. So if you look at these two folks, again, there's commonalities, as I said. You've got Gypsy, who is emotionally, socially behind. I mean, she's years behind. Okay, never went to school, never knew anybody. and meeting people through Christian dating sites and then get sexually abused, right? And then you've got this kid, Nick, who is emotionally, socially behind
couple
because he
years
has
older.
mild autism. Yeah. And then a colleague who tested him had an 82 IQ.
Wow.
That
82
puts him
IQ.
that puts him at the 12th percentile, meaning 88 out of 100 people that walk through the room his same age are smarter, right? So he's low functioning, low average guy, but they're both vulnerable for different reasons, had different paths to get there, but their likes attract, right? And somehow they needed each other. But if you had gone through this type of life, it's hard to imagine. There's mixed emotions. When I talk to Gypsy, there's like, God, I love my mother, but I think she may have said I hated her because of all of the, you love your mother because it's the only person really she knew, but there were miserable and suffering times, right? And it's not until now she's figuring this out and seeing that it was not normal. When you're living it and making a wish, there's so much good to it, right? Everyone loves you. And you'd never get that coming from where they live, low socioeconomic status. But nonetheless, you would almost think that even though you're in this warped bubble where your mother's the only person you know, you may have a disdain because you're handcuffed to a desk. You can't go out. You can't have friends. So, for us to think that killing your mother would be a fantastical, horrific thought. I think, again, if you're a victim of this type of severity of abuse, neglect through Munchhausen-by-proxy. So given that, I think that Nick had told her to get a hunting knife at Home Depot, Lowe's. She did. I think she may have bought the gloves, the pre-cut tape. I think he told her to have headphones. And so when he got there, he said, put the headphones on, go in the bathroom, basically so you don't hear me killing your mother and hear her wailing and screaming while I kill her and rape her. So, it took two here.
Yeah.
And I think this abuse, neglect, Munchausen by proxy by Dee Dee to daughter during this relationship she's building, she's starving to be with somebody, a guy, someone to care about her and to save her perhaps. So when they are developing this relationship, certainly she shared all of the, the by proxy issues going on. And even Nick with mild autism was like, hey, this isn't right.
Mm-hmm.
And I think it spawned developmentally together where, we need to do something. I need to protect you, but also, hey, there's some maybe pot of gold at the end of this. We can be together. But even watching them in their video post-murder in the hotel, they're like two little kids eating snacks, having sex, and goofing and giggling. Didn't really seem like they were their chronological age by any means.
A true understanding of what they just did.
Yeah, exactly. Like it's almost a cartoon or anime of like, oh my, like they're just kind of goofing around like this really happened, and that is the key to this, where these are mitigating circumstances as to their culpability and blameworthiness and ultimate punishment, or the way their case was dealt out. So when Mike, the lawyer, was saying, hey, my client was a victim of this torturing, suffering Munchausen by proxy, look at this. And they did research on it and they really investigated the case. Nick's the one with the the confession and the stabbing and the blood on his hands. So he's going to get more time, but certainly that should be mitigated as well.
82 IQ.
Yeah, well, autism as well.
As well.
Due to his and Dee Dee's influence, which I think has been based on my discussions with you, has been a little bit negated or diminished because she was always a victim and he was a bad guy. But why did she have the role? And that mitigation to her really should extrapolate onto him, okay, as well, because of his disorders. And what is this all about? It was actually in part to stop this madness, okay? But I do honor there was other gold at the end of the rainbow here.
Dr. Fabian said a lot there, some of which I found interesting because on one hand, he's acknowledging the abuse or his belief of the abuse of Gypsy. But I do think it's fascinating from a professional perspective where he's kind of saying right here that a lot of these mitigating circumstances that were applied to Gypsy and resulted in her getting a lesser sentence should have been extrapolated onto Nicholas Godejohn as well, where we know that's not what happened. He ended up with life in prison. So I found that very interesting coming from him, where he can acknowledge two things being true here, where it should have either been Gypsy getting more time or Nicholas getting less. We'll take our last break. We're going to finish up this interview, and then we'll talk about everything that transpired in the last portion of our interaction together with me and Dr. Fabian.
I love a great deal as much as the next person, but I am not going to crawl through a bed of hot coals just to save a few bucks. It has to be easy. It has to be streamlined. No hoops, no BS. So when Mint Mobile said it was easy to get wireless for $15 a month with the purchase of a 3-month plan, we called them on it, and turns out it really is that easy to get wireless for $15 a month. The longest part of the process was the time I spent on hold waiting to break up with my old provider. And they don't want to let you go. So to get started, you just go to mintmobile.com/crimeweekly. There you'll see that right now, all 3-month plans are only $15 a month, including the unlimited plan. And all plans come with high-speed data and unlimited talk and text delivered on the nation's largest 5G network. You can also use your own phone with any Mint Mobile plan and bring your phone number along with all of your existing contacts. And that's what I'm saying. It's so easy. You don't have to transfer things. You don't have to figure out how to do that. I'm not technologically savvy, so that's always an issue for me. But your phone is just sitting there. It's ready to go. You're just basically having the same thing, but saving a ton of money. So you too can find out how easy it is to switch to Mint Mobile and get 3 months of premium wireless service for $15 a month. Derek is going to tell you right now.
Yeah, we see it every month that our phone bills are going up and up every month, every year, and yet the quality of service isn't really increasing at the same length. And that's why Mint Mobile is a great option for a lot of people. You're getting that quality service, you're getting your internet plan, but for $15 a month, you really can't beat that. And none of the other plans out there are even close to that. So to get this new customer offer and your new 3-month premium wireless plan for $15 a month, go to mintmobile.com/crimeweekly. That's mintmobile.com/crimeweekly. So cut your wireless bill to $15 a month at mintmobile.com/crimeweekly. $45 upfront payment required, equivalent to $15 a month. New customers on the first 3-month plan only. Speeds lower than 40 gigabytes on unlimited plan. Additional taxes, fees, and restrictions apply. See Mint Mobile for details.
It is a busy season for us here at Crime Weekly, for me on my normal channel. Lots of things happening going into the holiday season, so it's going to personally be very busy. And with all the working, traveling, and my hectic schedule, I can hardly find time to go grocery shopping, and I can hardly find time to cook. But when I do, I always end up wasting food because I'm rarely home to eat it. And that's why Daily Harvest has been not just a lifesaver for simplifying my meal prep routine, but it's also helped me reduce food waste, which is very important to me. It's a win for my wallet and also for the environment. Now, Daily Harvest is a game changer for me because they deliver delicious smoothies and meals all built on organic fruits and vegetables right to my door. And these things can be stored in my freezer until I'm ready to use them. So I can get yummy meals, smoothies, and snacks that are ready in minutes without the trouble of shopping, prepping, or cleaning up. And when it comes to variety, Daily Harvest is always keeping it exciting. Like I said, they got tons of great meals, snack options, and smoothies that look so delicious and are ready in minutes. So we love Daily Harvest here at Crime Weekly. I think it just tastes very, very good, and it simplifies my life. And those are 2 reasons to check it out for yourself, and Derek's going to tell you how.
Yeah, and Daily Harvest they're OGs. They've been with us since almost day one. So if you want to support us, make sure you're supporting the companies that support us as well. We'd really appreciate it. So no matter how hectic the calendar, stay fueled with Daily Harvest. Go to dailyharvest.com/crimeweekly to get 15% off your first box of $100 or more. That's dailyharvest.com/crimeweekly. One more time, dailyharvest.com/crimeweekly. There's so much to unpack there. And we still have more parts to go in this series. And at the end, I'm going to give my overall opinion just from my background. And that's why it's important to have people like you on to kind of shed some light on things and to not give too much away here. I think, because, things could change as far as my opinion. I feel like two things can be true. I don't feel like it's binary where it's either yes, or all in or not. And so what I mean by that is you can agree that Gypsy, without a doubt, is a victim of Munchausen syndrome by proxy, or as you referred to it, factual disorder. I got to try to remember that one. Factitious disorder. Yeah. That can be true. And that could have contributed to the psychological effects that she's had now and how she views things. But to what you said there, when we look at culpability, me personally, just my opinion, Dee Dee, although Nick was the one holding the knife, Dee Dee Blanchard is not dead unless both of them are involved, because the motivation that Nicholas derived all of this anger from was based on what Gypsy told him. And then there's physical elements of it, which I don't even know. We're going through the story chronologically, so we haven't even got into the specifics of the murder yet. So I don't know all those details, but based on what we've just discussed here, there were physical elements of this murder as far as getting the knife, letting him in, that would have made his job a lot harder to kill her if not for Gypsy. So when we talk, and I know there's things that go on, deals, and we're not lawyers, we're not judges, but to me, and I think a lot of people feel this way, they both have mitigating circumstances. Nicholas has autism, low IQ. He's not able to process things the way most people would. Gypsy has her symptoms from her childhood and maybe some underlying things that we're unaware of. I don't know. So we're able to apply that to Gypsy as far as her charge and her ultimate, what she was convicted, what she pled to and what she got for a sentence. And yet you have her out after 10 years and Nicholas still in prison. And a lot of people, I don't necessarily think Nick should be out, but what I would say is this. Either they should both be out or they should both be in, because I don't really think this is a situation where it's clearly evident that one person was driving the ship and the other one was just along for the ride. I don't see that. I think they both have circumstances, mentally and emotionally, that inhibit their ability to process what they're doing, and yet one person is probably never getting out and the other person's making a lot of money doing TikToks. That's just where I fall. And that, by the way, not everyone's going to agree with me there. A lot of people, some people say, hey, Gypsy basically took care of her offender for her. Kudos to her. Congrats.
I cannot disagree with that, certainly completely. I mean, and assuming with what I've researched and talked with her about, I think, this is a Munchausen-by-proxy case. I think there was suffering and abuse and neglect. And I think Dee Dee was extremely sick. I've also read where people thought that, and you've referenced this, where Gypsy, had traits of her mother as being manipulative. And why did she choose Nick? Oh, because he was
easily
vulnerable with autism.
Malleable, for sure.
Yeah, right. And but I think, again, they're both vulnerable. And that vulnerability leads usually to that moral culpability with blameworthiness and ultimately to punishment, maybe reduced charges, but usually not to like a legal defense of insanity. And we did not have that here. But it is a big pill to swallow when she's doing TikTok and he's got life without parole. Now he's the one that confessed, to murdering her, but he was also in this like role of, wanting to protect her. But there was also this good and evil part to him and a sadistic component. Now he talked about sexual homicide and rape and murder, but then said he ultimately did not. So it seemed to me there was a more demonic element to him
Interesting.
and to his motives, and I think there's a gender issue here, male, stronger, female, more vulnerable. Plus, again, she was the child. But I think that, that the mitigation leading to, less culpability and maybe a lesser sentence with some light at the end of the tunnel, like with the possibility of parole, maybe should have been considered by the trier of fact. I think there was a significant problem with the heinousness of this case. And you're also in, kind of Springfield, Missouri, very conservative, as they say, Bible Belt area of the country, where the heinousness of this case and the judges there in that jurisdiction are very, strict and punitive.
Yeah. I think there's also an element of looking at what we have here. Is there a possibility of reoffending? And now with Nicholas, obviously you haven't had the chance to evaluate him, but where I'd kind of like to round out this interview is your conversation with Gypsy, because when you interviewed her for A&E, she was still in prison and she was looking at parole relatively soon, right? Was it soon she was coming up for parole? Or fill us in on that whole encounter, not only how that came to be, but also your interactions with Gypsy and what you took away from it.
Sure. So when I was contacted by A&E, they say, hey, we want to look at this as a future oriented kind of documentary. We know that she's going to be released, and we want to know really what she may be facing, someone that's been through this type of trauma. And I think that this was spun into some other documentaries or shows of Gypsy in real life, right? And with that said, though, they said, "Will you talk to her?" And I said, "Sure." So we rang her up on the phone in prison, and I said, "Hey, I was supposed to evaluate you," and she knew that, and she knew Mike, Stanfield, her lawyer, and they had talked about it. And I said, "So, well, hey, this is second place. We'll talk anyway." And, we talked about, her history and her insights and, some of her growth, where she'd come from and where she is now. And, they kind of, you were asking me, the risk of her having problems in relationships. And I really, Derek, did not know how big this was. Okay. Like social media. As to my old roommate, he said, "My kids are watching this. Don't say anything bad about Gypsy." And and I was like, "What?" And then, oh, wow. I didn't, but I did say that I had concerns as to her dating and relationship fortune. So I was very concerned because, and I guess I was right with that prediction because she was married, briefly divorced.
Yep.
So
now
we
she's
had
got a baby
talked,
on the way with someone else.
and she had a fan club, and she was, meeting a lot of men were attracted to the case, to her. She was getting contacts through jail mail, and, also through internet, email, websites of contacting folks in the community with prisoners. And she had a fan club, a harem, what do you want to call it? And she had no loss of
suitors,
chances to meet guys.
Yeah.
Right. So
it's usually the way it goes. It's a weird world. That's a whole separate episode, but yeah.
It totally is. Yeah. So with that said, though, it places you at with some other problems, right? And it's great to have attention, but hey, that's what this, that's what some of the other sector was saying earlier. Hey, this is all about attention. She wanted it with her mother, and now it's more of the same, right? And she's used to that. So she gets out of prison, she's on TikTok, she's on shows, whatever. Now, but you know what? You can't take what the girl out of the Munchhausen-by-proxy or or the by proxy out of the girl, so to speak. So, I mean, you're always going to be damaged from that.
Yeah.
Even if mom is dead, I mean, you were born at what, 26, 23, whatever it was. And now you have no social skills and you're psychologically like a kid. Right. So, and it's hard to catch up. It's hard to navigate through life like that. And she did have good family support she talked to, and I'd seen them in these episodes and documentaries, her mom or stepmother and her father. And, they tried, and I think Dee Dee really sheltered them and didn't want her father to have any connection. So, with that said, though, I mean, she had reunited with her family, was trying to, bolster and improve those relationships. And I don't think she really had a good appreciation as to all the issues that she'd be facing and really how difficult it would be to navigate the world living in a bubble with Dee Dee and then going to prison, right?
Yeah. So do you feel, based on everything you just laid out now, because I'm going to ask the same question for Nicholas, but do you feel, based on what she's been through, that it's something, I don't know if she's still speaking to someone, I'm assuming she is, but maybe not. What was your takeaway from that interview? Do you feel like she's someone that it could still be, have a risk of reoffending? Or do you think that that chance of reoffending died with her mother, so to speak, because that was the monster in her life, that she slayed that dragon?
Most people who murder or are involved with murder rarely do it again.
Yeah.
I think
Why
she's
is that?
It's such a rare event, and a lot of it the circumstances of it, the situation, the intoxication, the relationship, the situation often doesn't recreate itself. And people age and they become a little bit more civilized, and there's different reasons, but the rate of reoffending of a homicide for a homicide offender is extremely low, and often they're incarcerated for years and get out and they're a different person and they've aged. But nonetheless, I think she's more of at a high risk to be involved in dysfunctional relationships with men, and even being part of victim or perpetrator of domestic violence incidents. I think that would be much more likely risk.
How long did you get to talk to her?
It wasn't that long. 15 minutes. We chatted. It was just getting a little history summary, and it wasn't maybe longer than that, but it was probably, I would say less than a half an hour.
How'd you find her? Just personally, did you find her believable, charismatic? I mean, what was it? Anything about her that you concluded or took away from it?
Well, she has a kind of a high pitched voice,
Yep.
and I on one hand, I would think, how would I be as a child with my mother murdered, I guess with my hands in it, and had been suffering like that. But again, you only know what you know. So a child like that, or other people I may evaluate with horrific trauma, they may not appreciate how bad it was, the traumatic effects, because they don't know anything else. So it's hard for a person to know how damaged they are themselves.
Mm-hmm.
Until they kind of get out in the world, and then they're struggling. But I think that it was kind of surprising of how upbeat and excited and not as melancholic and down as I thought maybe she would be, and for as much as she's gone through. But I mean, that I think that it is an unrealistic, but maybe a good sign, because it was positive and upbeat, right?
Yeah. Final question. In if there's a world, because you talk about reoffending and all these things, and again, you'd have to evaluate him personally, but ending this conversation on Nicholas Godejohn, because as you said, life without parole, he's in there forever. But there's a lot of mitigating circumstances in that situation as well. If for some reason there was a world where there was an appeal put into play involving Nicholas Godejohn, do you have an issue based on what you do know about him? 82 IQ, autistic, the dynamic, the power dynamic of Gypsy and Nicholas's relationship, as far as it maybe being more even than some believe. Do you think there is a world where he should be given a chance of parole, where he could get out and wouldn't be a danger to society moving forward if he did get out?
It's a good question, as you said, and I did not evaluate Nicholas,
some
but
time.
Right. But we do know a couple of things. So we know that he has, what we call one or more neurodevelopmental disorders, basically a compromise in brain development, functioning, in this case, autism, but an 82 IQ. There's a lot of autistic folks that are very bright and have average, above average IQ. So there's going to be some learning issues there. I don't recall if he had a history of ADHD, but what I would be concerned about here, from the little I know, is he's, as we talked about, arrested for some type of
McDonald's
exhibitionism, looking at pornography, I think on a phone or a laptop at McDonald's, public place, masturbating, high risk behavior, not physical touching or assaulting. But then you have the BDSM, which I think in part was fueled or reciprocated with Gypsy, but you have
there's definitely some rough sex going on there, allegedly, according to her.
Right. And you have violent sexual talk fantasies and violent sexual rape threats, although he said he did not do that to her. There was, given the prior sex offense, the exhibitionism, the sexual violent fantasies, and the murderous behaviors, the mental disorders, and I don't know if he was abused or neglected. Certainly have concerns about that. Those are, the sexual violent component to this and his young age is concerning. So, that's where I would leave that.
I think a lot of people would like to see some type of appeal, to have that opportunity to have someone like yourself go in there, evaluate Nicholas, and see what they uncover, to see what type, because you're given the opportunity of parole, it doesn't mean you're going to get out. But as it stands right now, that's not even an option.
No, I think an appeal, I believe that they did present evidence, but there was both a prosecutor expert and a defense expert who kind of fought about those issues. And, but there'll certainly be appeal issues as to his mental health evaluations.
Yeah. Fascinating conversation, Doctor. I appreciate you coming on. I think it's important to hear all sides of things. This is coming from someone who is in this field, does it for a living. You've heard his thoughts on it now, as far as how he feels, not only about the actual incident, how we're all here with Dee Dee and Gypsy, but also some of the insight that he shared as far as the murder itself and where we are right now. I think it's fascinating stuff. Some people will agree with everything he said, some people won't. And as I said earlier, two things can be true. You can have Gypsy be a victim of Munchausen syndrome by proxy and also an offender of murder. And conversely, you can have a situation where Dee Dee Blanchard is an offender of Munchausen syndrome by proxy, but still a victim of murder, and the people responsible, specifically Gypsy, should have been held more responsible for what they did. So I think it's not black and white. And I'm looking forward to the discussion in the comments. If anyone would like to hear more from Dr. Fabian, as I said at the top of this interview, Forensic Neuroscience and Violence, it's available on Amazon. I'm going to have the link below. You can order it right now. It's up for pre-order. Dr. Fabian, there's one caveat to this. I want a signed copy.
You got it.
Okay, so that was my interview with Dr. Fabian. We discussed a lot. I appreciated him coming on and speaking with me. He doesn't have to do it. He didn't get paid to do it, so I do appreciate him doing that. I had some thoughts there that I was going to say at the end here when we kind of gave our final thoughts, but I said a lot of it in the actual interview, as far as how I feel about compartmentalizing the different incidences and the level of culpability for each person. So I can elaborate on that, but I don't think I really need to. It's pretty straightforward. I feel like Gypsy was a victim of child abuse, but I also feel like she got a pretty good deal with a murder, and she probably should have did more time. But if not, Nicholas Godejohn should have got a similar deal. And so that's kind of where I fall on it. I don't feel like, because she was a victim of child abuse, which I do believe, that would have mitigated the circumstances of the murder to the point where she would get 10 years and Nicholas would get life without parole. I don't think it's that big of a discrepancy. That's where my issue is. However, you're going to be breaking down the whole murder for us as we continue on in the series, and maybe I'll feel differently, or maybe it'll just confirm what I already believe. But that aside, what's your thoughts on everything you just heard? I could see you writing notes. I could see your head wagging and doing all this other stuff. So go for it. The floor is yours.
All right, I'll start with the negatives so I can end on a positive note.
Okay.
I don't really like the way that Dr. Fabian is talking throughout this interview. Once again, he is an esteemed mental health professional, and yet he continues stating, as if it's a fact, that Dee Dee Blanchard had this Munchhausen-by-proxy. Or this.
No, she'd be a victim of Munchausen-by-proxy.
Dee Dee.
Oh, Dee Dee, you're
Yes.
saying would be the, yes.
He keeps
Factitious
saying,
disorder.
yes, he keeps saying, Dee Dee's, and he even said at one point, Dee Dee's, craziness and her factitious disorder. He does not know that. There's no possible way he could diagnose her with that. It's almost, and in my opinion, it's a little unprofessional to keep framing it in this way throughout this interview.
I completely disagree. I want to just make sure that's clear. Completely disagree with you.
I will entertain that, but to state it as if it's a fact when he never even spoke to her, he spoke to Gypsy for less than half an hour. And even in cases where, let's say, Dee Dee Blanchard was still alive and could be evaluated for factitious disorder by proxy, or, whatever we're calling it right now. Even in that case, it is incredibly difficult to diagnose somebody with this disorder because of the dishonesty that surrounds the people involved. So even when the person who's being analyzed for this is living, it's very, very, very difficult to give a solid diagnosis of this factitious disorder. So when he keeps framing it in this way, I don't like the way it's framed. He could say, in my opinion, her factitious disorder, in my opinion, but he's not saying that. He's stating it as if it's a fact, and I'm uncomfortable with that because it's not. I also don't like that he started talking about Gypsy Rose and Nicholas Godejohn, and he said, there was something more demonic about Nicholas Godejohn. Demonic? What? In what?
Dark,
Where?
I think he said.
He said demonic. I wrote
Demonic?
it down. He said there was a demonic element
Okay.
to Nicholas Godejohn. And then he in the next breath, he says, and obviously, like, there's a gender element, which I completely agree with. The fact that Nicholas Godejohn was a man and Gypsy was a woman, and how society views men and women very differently. And I think we can see that in their sentencing, in the way that they were treated by the legal system. But then he goes on to say, and Gypsy was a child. She was not a child.
Yeah, she was 23.
I think
I heard that when he said it originally. I think he misspoke.
She was 23 years old. She was not a child. So what did he call her in prison for? What was his explicit motive for doing that? Because he was no longer being asked by Mike Stanfield to do that. As far as
A&E had him reach out because they wanted to see going forward if she's someone who would be a danger to society, would she be at high risk for reoffending? How would she function in the real world out there now with all of this transpiring? So,
and then he spoke to her. He said 15 minutes, definitely
under. I said no more than 30.
And then definitely under half an hour. I don't think that that's long enough, especially when you're dealing with somebody like Gypsy, who's a walking contradiction, a walking, as you referred to it earlier, compulsive liar. I don't believe that is anywhere close to enough time to get a solid understanding at all of what she's saying, what she's feeling, what her mental state was like at the time of the murder, what her mental state was like at the time he was talking to her. I feel like, especially with somebody like Gypsy Rose, you're going to need multiple lengthy sessions to get through all the bullshit and to be able to see the many times she contradicts herself, the many times she lies, to call her on that, to clear those things up before you even can start to unravel the ball of yarn that is Gypsy Rose. So yes, the only reason I don't like the way he's framing things is because, once again, for people who are not familiar with this case, they're going to hear somebody like Dr. Fabian with his credentials, and they're going to, and him saying, Dee Dee Blanchard's factitious disorder, and they're going to take that as in, oh, she was diagnosed with factitious. She was not. And even if she was alive,
she was dead.
She was dead, but even if she was alive, it is still incredibly, incredibly, incredibly difficult because of the dishonesty that these people exhibit to diagnose somebody with this disorder. And it's already rare to begin with, okay? So those are the negatives. Now, the positives. He earlier on spoke about how Gypsy's childhood framed her for the way she would go out into the world, and I completely agree. When you're a child, your brain is making connections, forming synapses, it is creating the core of who you are. And when he mentioned something about damaged attachment, he's talking about Gypsy's attachment to everybody, right? Because her attachment's going to be formed in childhood with her basic and primary caregiver, which in this case is Dee Dee Blanchard. So she's going to have a very disorganized attachment. This is going to impact her interpersonal relationships forever going forward. Now, does that mean there's no hope for her? Does that mean with significant and intensive psychological help, continued psychological help, that she cannot become more secure in her attachments to others and find a way to have healthy relationships? It's not going to be easy, but it's possible that she can absolutely get better with that. But I can absolutely see how she'd have a horrible attachment style going forward. And we can see that, as you mentioned with Dr. Fabian, illustrated in the relationships she's had during her time in prison and after. I mean, Gypsy Rose's love life has become an online reality TV show at this point, and she's all about it. Damaged self-esteem and identity, interpersonal issues. Yes, all of those things. This is why she was looking for somebody to save her. When people do not have a solid, concrete identity, they seek it out in others. And this is why she was always trying to form romantic attachments, because she would base the way she viewed herself through the eyes of whoever is her primary attachment at that point. It was Dee Dee Blanchard for a long time, and then what was his name? Dan, that she became obsessed with, and then Nicholas Godejohn. So I completely agree that this person, Gypsy Rose, did not have the best start at all. But so many others don't. And so many others do not go on to convince a low IQ, autistic young man to kill their mother. And even Dr. Fabian mentioned something where Nicholas Godejohn had handed Gypsy headphones and said, put these on so you don't hear me killing and raping your mother. Nicholas Godejohn, he did not rape Dee Dee Blanchard. So I wanted to clear that up as well, because once again, that was not clarified. When he said that, he did not come back and say, oh, there was actually no rape that happened, et cetera, et cetera. But yes, I believe that Nicholas Godejohn had mentioned something like that to Gypsy, but no, he did not do that. So I wanted to clear that up as well. It's very unfortunate that we're in this situation where we are, because at the end of the day, where do the answers lie? And we kind of have to go back to the beginning of this episode. I believe the answers lie with Gypsy's doctors. Gypsy's doctors would easily be able to clear this up and come out and say, actually, she did need a feeding tube. Or, you know what? She didn't, but her mother was so insistent, we did it. Or actually, she didn't need her salivary glands removed. We just did it because her mother told us to. Or they could say, there was an actual need that we determined medically she needed those removed. The answers lie with the doctors, because if Gypsy needed those medical procedures, then we would have to kind of question whether or not, factitious disorder or malingering or whatever was even at play here, if those were truly and genuinely needed. So it kind of feels like there is a lot of missing pieces, but they're big missing pieces. They're important missing pieces. And so I'm wondering why there hasn't been any investigation into Gypsy Rose's doctors, and why nobody has spoken to them. Because if there was a trial, that certainly would have happened. Those doctors would have been called to testify. So I'm wondering also, is partially some of the reason that she was given a deal was because the prosecution knew that we would have a lot of people, a lot of important people in the area affiliated with important medical centers and facilities who would have to answer yes or no, did she need these medical procedures? And if the answer was no, then these people would sort of be in the hot seat. And maybe that just seemed far too controversial. Maybe they don't, they're already having this huge attention. As he said, internationally, this is the only case of a factitious disorder where the victim as a child goes on to kill their parent, even though, once again, Gypsy was 23 years old. So technically she was an adult. But the victim of Munchhausen-by-proxy or factitious disorder goes on to kill a parent. This is the only case. So they already have a lot of heat and a lot of attention coming to this area. Do they want now this whole controversy about these doctors from this area, who are once again associated with a pretty big medical center in the area, to have to sit in court under oath and answer for what happened medically with Gypsy Rose? And that's kind of what I plan to look into going forward for the next episodes. But what are your thoughts? Final thoughts?
I think it would be good if you look into the medical records because, listen, as you said, we had Fancy Maselli on at the request of a lot of our commenters. There were a lot of people who are on board with the idea that Gypsy was not abused, that this was a chromosomal disorder and all of these things that she was treated for, she needed. And this isn't to bash Fancy, but we played clips of that interview, but you can attest to this. There was a lot more pushback I gave her that we didn't play. And that partially was just out of respect and also for efficiency of the episode. But maybe in hindsight, we should have included more. Maybe we should just have ran the whole thing like we did this. But, and this isn't to bash Fancy, but the facts are the facts. You know, I didn't know Fancy before the interview, but the reality is Fancy Maselli, that's not even her real name. And, you know, she's had her own issues in the past with fraud and theft. So it's tough to take her at her word. That's just from me. I'm not saying that. I'm not speaking for you, Stephanie.
I don't take anybody at their word.
For me personally, after hearing from Fancy and hearing the arguments she made, I was left wanting more. And then as I started to learn about her background a little bit, it did make me question some things, which is why I was really focused on getting another independent person on the show who had a professional background and who maybe didn't have as much involvement with the original case or as much involvement with Gypsy's family originally. So I will say this, he was speaking from a general sense. He probably could have qualified a little bit more, like you said, saying things like, in my personal opinion. So I'm glad you're doing that. But I don't think would ever go on record and testify under oath based on his involvement to this degree.
I don't think so either.
Yeah. He was potentially going to be involved. He wasn't. If he had been involved or if he was involved in the future, I have no doubt that he would do the research needed to do it. Now, as far as
his opinion might be different at that point.
His opinion might be different, although, listen, I won't even go there. Where I'm coming from, outside looking in, and I think where he's coming from, and a lot of people are coming from, yes, there's no way to prove that she experienced child abuse. Forget for a second, everybody listening, this is where I'm coming from. Take my word for it. Follow me on this journey or don't. I'm not focused on the phrasing of factitious disorder or Munchausen-by-proxy or malingering by proxy. I'm not focused on that. I'm simplifying it in my own brain because I'm not that bright. And in my own brain, I'm asking myself, was this young girl abused or not? To severity of it, I may never know. Dee Dee's not here. You've pointed that out numerous times. Do I personally believe she was abused? Yes, I do.
If she needed those medical procedures, do you still then think she was abused?
Yes. And the reason I think she was abused is because we have physical proof of it. In my opinion, just seeing a video where there's a mother in the background and a child with a shaved head receiving a home because she has cancer, and the mother hasn't come out and correctly fixed that situation and come forward and said, this is not true and done all that. That to me is a form of child abuse that we have right on camera. So the significance of it, where it falls, that's up to you. But I could see and witness a personal video from a news station where, in my opinion, that is a physical version of child abuse, where it makes me think that if that's what she's willing to do on camera, in my opinion, she's probably willing to do more behind the scenes. But that is a stretch by me. That is my opinion. That is not verified. But we do have proof of child abuse right on film for everyone to see. And I do believe that more than likely the prosecutors, which you've pointed out, there may be a part of it where they were concerned about doctors who would be held accountable for their inactivity. But I also think part of it is them doing their own investigation and realizing there might be some validity to what Gypsy's going to say. They felt like if they put Gypsy on the stand and those things came out publicly, Gypsy might walk free because of the level of child abuse that would be put on during the trial. And the jury would find her not guilty of anything. They weren't willing to take that risk. They were like, you know what? If we put this girl on the stand, even though she's 23, she talks and acts like she's 15, They're going to put out all these things that she's gone through, and this jury's going to find her innocent, and we don't want to risk that. So we'll take 10 years over anything. All of that being said, what I'm really concerned about at this point, because I have come to the conclusion after these 4 episodes, it's my opinion that she was abused, which I think is really what this is all about up to this point. When we talk about Fancy and we talk about Dr. Fabian, is, do you believe she was abused? Do you not? Because there's 2 camps. People feel differently about it. You're entitled to your opinion out there. You can talk in the comments below about it. We've presented both sides. You may agree with one or the other. That is your personal choice.
We've presented 2 sides, but there's so many sides to this.
I'm sure. Well, there's gradients to it, and the truth is, you'll never know. The quote unquote offender's dead.
Yeah, it's so
and
tough.
Gypsy is a known liar. That is also a fact.
But also, it's like, is Dee Dee a quote unquote offender? Is she any more of an offender than Gypsy? Because if what we're hearing from Dr. Fabian and what we know about Dee Dee's background is true, she too was a victim. And so she would be just as much of a victim.
What are you talking about? Well, you lost me there. What is she a victim of?
Because he was speaking about how her mother had imposed almost this. So
Dee Dee was a victim of some child abuse as well.
Then Gypsy was a victim, but does that make Dee Dee any less culpable for what she did to Gypsy? And does it make Gypsy any less culpable for what she did to Dee Dee?
Clearly, that's what happened. I think you just laid it out. You have a situation where Dee Dee was never charged with anything, and you have
she
Gypsy
was murdered,
and you have Gypsy who killed her mother, only getting 10 years.
Yeah.
So they all got mitigating circumstances. Dee Dee never was charged with a crime.
Well, she was murdered. So I would say she paid the ultimate price at the end of the day. And now in her death, after her death, we have people speculating on whether or not she had this mental illness or whether or not she was abusive and whether or not she did this and that.
But we have proof she was abusive.
We have proof that she did some things. But I mean, you could say that she shaved her daughter's head and said, listen, Gypsy, you don't have cancer, but we're shaving your head because we need this stuff. We're poor, we're broke. I'm a single mother. I'm not getting any child support from your father. We got to do this. I need to be able to provide for you. And I don't know how to do it any other way. And you
that is a form of abuse.
I agree. It's a form of abuse, but at the end of the day, was it abuse for, oh, I want attention for myself, I want people to think I'm great? Or was it abuse as in, this is unfortunately based on our socioeconomic status, based on our circumstances,
that's a slippery. The motive, the why.
The best we can do, and now you have Gypsy who's doing basically running a grift of her own online right now.
Yeah. Listen, not to make it about personal things, and we both had our stuff, but like, I didn't have shit growing up, and it would have been a lot easier if my mom did some things to make our lives easier.
And a lot of people do, dude.
So, but that doesn't make it right.
No, but it doesn't make what Gypsy did right, and it doesn't make it.
2 things can be true though, Stephanie.
Yeah, I know.
You keep saying like, oh, well, it doesn't make it right that she killed her. My point being in all this, and I said it in the interview, 2 things can be true. You can have Dee Dee, who is a offender of child abuse, but also a victim of murder. That is true.
And also a victim of, what is this, factitious disorder as well,
with her
right?
kids, but that, yes.
With her own parents.
Right. I don't know where you're going with that, but yes, correct. I get that. Yes, she could have been a victim as well.
It's a cycle, like the victim becomes the abuser, and so then in this case, Gypsy then... Okay,
so we'll go victim, offender, victim.
And then Gypsy, victimizes Nicholas Godejohn in a way, and now who ended up getting the raw end of this deal? It's
Nicholas Godejohn.
Nicholas Godejohn and Dee Dee Blanchard.
Which no, I wouldn't argue that completely.
You think Dee Dee Blanchard deserved to be murdered?
That's your words, not mine. What I'm saying is what happened was a result of child abuse.
This is a slippery slope because many, many, many people are victimized in child abuse and abused as children, and they do not murder their parents. And at the time that Dee Dee was murdered,
condoning that.
At the time that Dee Dee was murdered, which we will get into, she was far too sick and basically bedridden to be doing any abusing. Gypsy could have walked her ass right out of that house and rode off with Nicholas Godejohn in the distance, but then she wouldn't have gotten her mom's money. And she wouldn't have gotten, So there's a lot of gray areas here.
That's a different conversation. Because if you're going to talk to me about that, then you're going to get a different answer from me. Because as we go through the murder, based on how I view things like this, I viewed it the same way with the Menendez brothers and other cases as well. I don't think that Gypsy served enough time based on the dynamics of the relationship, based on what she experienced, what Nicholas Godejohn experienced. I don't know if 10 years is enough, honestly. And if it was enough, then Nicholas Godejohn should have been given parole at 10 years as well.
Or just not life in prison.
Or not life in
maybe a
prison.
little bit longer because, yes, he did hold the
Correct.
murder weapon, but life 10 years compared to life in prison with no chance of parole.
No, I don't agree with that.
Is ludicrous.
That is a different thing. I think up to this point, for sure, where we were really breaking down the child abuse versus non-child abuse. Was this needed or was it unnecessary? And I don't think after this episode, everyone's going to say, oh, yep, makes perfect sense now. We've presented, like you said, at least two sides. There are many others. And, I did give Gypsy the opportunity to come on the show. Didn't expect that to happen. I will say someone reached out to me claiming to be her friend, saying that things could go through her. I don't know if she was her friend or not. And frankly, I wasn't interested in any other parties connected to them personally. I wanted a professional or nobody at all. And if it was her lawyer or something like that, I would have entertained that for sure. But, friends and family members.
Oh, because her lawyer is not as biased as her friends and family members.
Well, that's what I'm saying. But he would be representing her. That's what I'm saying. So I would let him come on and defend her. That would be great. I would love that opportunity. But that didn't happen. I think we've shaken this tree enough as far as you're going to develop your own opinion, look up your own research. Now we get to move on in the story and talk about the murder itself. We had started diving into the DMs, the Facebook messages, and the whole quote unquote plan B, and talking about how there wasn't even a pill back then of plan B. So she was definitely talking about an alternate plan to what she originally thought, which as I was going back and watching our episodes over this last month. To me, it seems like the first plan was to get Dee Dee to like Nicholas. If that didn't work, to get them to, get her pregnant or get something to happen where she would have to accept Nick. And then if that didn't work, they would have to kill her. So I do think there were different variants of the plan. And ultimately, Gypsy decided, hey, she's not going to ever accept Nicholas Godejohn. She's got to be removed from the equation.
So you're saying the motive for murder was because Dee Dee wouldn't let her be with Nick Godejohn, not the fact that she was abused?
I can say that she was abused and still not agree with the fact that she decided to murder her offender. And that's the difference there. I think there was an opportunity for her to leave. Now, there are going to be people that argue with me that, she was locked there, she was handcuffed, all that stuff. We can get into that, into the motive. But it's the same thing with the Menendez brothers. Although I know it's not a carbon copy and people are quick to come for us in the comments and say it's not the same. But if you have the physical capability of leaving, you're 23 years old, leave. I don't think it gives you the right to murder your offender. I just don't. Now, if you do, I think you need to serve the time for the crime you committed. I've said numerous times on the show, and some people have said in the comments, oh, you and Stephanie say that if someone ever hurt your child or molested your child, you would, I don't want to say the word here, but you would handle it.
That's something that every parent, I believe, in their heart, fears almost, right?
And guess what? I stand by that. The difference being, I wouldn't get up there and make excuses.
Yeah, you'd be like, I did it. Take me away. Yeah.
Here's my handcuffs. Here's why I did it. Whatever I get, I can live with. I wouldn't be telling you my life story of how I got to this point. I would tell you I did it because I wanted to, because this happened, and I'm prepared for whatever consequences I face. That's the difference. Okay. So that's where I think there is a different factor between some of the people we discuss and what we sometimes say about our own children. So
a lot of things to think about. A lot of things.
Yes.
A lot of things. I mean, I did make a lot of notes, and I've got stuff to ponder.
Let's do it. Well, anything else before we close the curtain on this one?
No, and I'm glad we actually did this before we started talking about the murder. I'm actually very glad that we had I was almost like, oh, this is disruptive to the timeline. It's going to be weird for me, but this has given me so much to think about and a frame of reference to go forward now with the next episodes.
Yeah, absolutely. Well, we're back and we appreciate you guys being with us. As always, please like, comment, subscribe. It'll get us in the algorithm for YouTube. It moves us up on the ranks for audio and gets more people to see it. And with us being off a month, that's just the way it goes. We're going to be kicked out of the algorithm for a lot of things because we haven't been posting regularly. So we would appreciate your help in that matter. But either way, thank you for being here. Everyone stay safe out there, and we will see you next week.
Bye.